Welcome to the WRHA Long-Term Care Mealtime Assistant Training Program. This is a self-learning tool for volunteers and family members assisting residents with eating in long-term care. There is also a quiz to complete after this presentation to help verify your learning. This presentation will cover key definitions and also a detailed review of the 8 standard feeding procedures. These procedures can be divided into things to do before the meal, during the meal, and after the meal is completed. This presentation and training is coordinated by the WRHA Long-Term Care Speech-Language Pathology Services. This is also in compliance with the WRHA Regional Policy for Feeding and Swallowing Management of Residents in Long-Term Care. You are listening to this presentation today because you will be helping assist someone to eat who may have trouble chewing and/or swallowing. You have a very important role in the care and well-being of people who depend on others to eat. The information in this presentation will help you feed a person safely and help you learn what to watch for. Let's begin with some key definitions. Eating includes both feeding and swallowing. This is an experience that involves physical, social, emotional, and psychological aspects. Swallowing is a process that takes food, liquid, and saliva from the mouth to the stomach. Feeding involves the placement of food in the mouth. Dysphagia is a medical term for problems with chewing or swallowing. It can be caused by many things like weak muscles, changes in the brain, and forgetting how to chew or swallow. Aspiration describes food and/or liquid going down the wrong way and into the lungs. Choking happens when the airway is blocked off and no air can come in or out. These are the 8 standard feeding procedures. Anyone who assists a person with feeding must follow the 8 standard feeding procedures pictured here. It is your job to know what to do for each step. Training for volunteers and families is required as part of the WRHA Regional Policy for Feeding and Swallowing Management of Residents in Long-Term Care. This increases resident safety while eating. Standard feeding procedures will be grouped in 3 stages: what to do before a meal, what to do while feeding someone during the meal, and what to do after the resident has completed the meal. Before the meal begins, locate and review the resident's care plan. Take note of details such as what diet order they should receive. Take note of any specific feeding and swallowing strategies that you should use. Make sure the resident is seated in a good position for eating. And check the diet order listed in the resident care plan and compare to what food is actually given on the tray. Standard feeding procedure number 1. Check the care plan. Know all the recommendations before you sit down with the person, including diet texture, whether the liquids need to be thickened, and if so, how thick. Know any resident-specific feeding recommendations and any other helpful cues or setup needs. For example, a person may be on a soft diet cut up bite size with mildly thick fluids, with notes of specific safe feeding and swallowing strategies including alternating sips of fluid, provide cues to slow down the pace, and serve one item at a time. Other things to check at this point before the meal include: make sure the resident has their dentures in place, hearing aids on, and glasses in place. Make sure any specialized cups, plates, and cutlery are also available for use. In general, reduce distractions such as the TV. Standard feeding procedure number 2, resident mealtime positioning. The resident should be seated comfortably upright in a chair during mealtime. Hips and knees should be at 90 degrees, with arms, legs, and body supported well. Avoid standing over a resident when feeding. This helps the resident not tilt their head up and back to accept a bite of food. Encourage the resident to have a nice, neutral head and chin position to easily accept food or drinks into the mouth. Eating in bed is discouraged generally. Eating in bed may be permitted at times only if directed to do so by the nurse for specific medical reasons. If required to feed in bed, staff may need to boost the resident so that they are sitting as upright as possible. Use bed adjustments and pillows. For example, adding a pillow behind the upper back instead of behind the neck, and an extra pillow under the knees. This enables us to get the resident in the right position for eating. Ask for assistance from staff to help readjust the position of the resident as needed. Standard feeding procedure number 3, diet order. Check that the foods and liquids that have been served on the meal tray matches the diet texture and liquid consistency order. Tell a nurse if any items brought on a tray do not match the order. Do not give the residents items that do not match the order. And be cautious when giving residents items that they are requesting. At this time, diet textures for solids include diet types such as regular diet, soft mince diet, minced diet, total mince diet, pureed diet, blenderized diet. Fluids can also be served as thin or regular consistency, mildly thick, which is a nectar-like consistency, moderately thick, which is a honey-like consistency, or extremely thick, which is like pudding consistency. Tell a nurse if an item brought on a tray does not match the order. For example, if a resident receives a whole pork cutlet and the diet texture is listed in the care plan as minced, this is an error as the pork cutlet should be minced up. Another example is if a resident receives a soup that has a very thin consistency and the care plan states this person should receive a minced diet with mildly thick fluids. This is an error as the soup should also be thickened by staff to a mildly thick or nectar-like consistency. Do not give residents items that do not match the diet order. Familiarize yourself with all diet texture levels at your site. More specific information and training on types of diet textures is available and should be completed along with this training. During the meal, we will discuss feeding position, which involves putting yourself in the ideal feeding position, and safe feeding strategies while assisting the resident with their meal. Standard feeding procedure number 4, ideal position for feeding. This is your position. Take a chair and sit beside and at eye level with the resident you are helping. This allows you to watch the resident easily. This also enhances any conversation and interaction you have with the resident. Focus on feeding the resident safely. Standard feeding procedure number 5, safe feeding strategies. This is a list of general strategies that can be used for everyone while assisting them with eating. Ensure that the resident is alert and able to participate in the meal. Adjust the tray and plate position as necessary. Avoid mixing foods together unless it is specifically requested by the resident. Use teaspoon amounts to give small bites and give small sips of fluids. Feed at the resident's pace or slow down if needed. Wait and watch for the swallow at the throat. You can see this with an up and down movement of the Adam's apple. There are many other safe feeding and swallowing strategies that may be recommended by a speech-language pathologist for a particular resident. You can find these in the resident care plan. This is a list of some resident-specific examples of safe feeding and swallowing strategies that may be recommended for some residents. alternating sips of fluid after each bite of solid, adding extra moisture, gravy, or sauces to foods so that they are more slippery when swallowing, placing food on the stronger side of the resident's mouth. This would usually be for someone who has had a stroke and has a weak side of the face. Empty spoon technique means giving a fake spoonful with no food on the spoon in order to help cue someone to swallow what is already in their mouth. Offers small sips of fluids to help a person start the swallow reflex if they are holding food in their mouth. There may be a recommendation for no straws to be used, or alternatively, using straws, and this will be listed specifically in the care plan. Set up the tray with items off to one side. This may be for someone who experiences difficulty seeing items on one side of their body or isn't able to see items on one side of the meal tray. Also, serving one item at a time. This can also be effective when someone is easily distractible. You may instruct someone to swallow with a chin down or chin tuck posture if specifically recommended. Cue the resident to swallow 2 times per bite, and look in the mouth at the end of the meal to make sure all the food and residue is clear. Other things you can do during the meal include taking an interest, talking to the resident, telling them what they are eating, describe the meal or bite that you are giving them, allow the resident to enjoy the different tastes of the food, involve the resident in conversation, offer choices where available, avoid any negative comments about food textures and drink consistencies. Do not rush the meal. Overall, these strategies help to make the dining experience pleasant. It is helpful to know, for example, the menu items of the day so that you can describe the meal and give choices to the residents you are helping. Standard feeding procedure number 5 continued. What to watch for. If you see any of the following signs of difficulty, make sure to tell the nurse. Watch for liquid or food coming out of the mouth, poorly chewed food or difficulty chewing food, spitting out food, pocketing of food in the cheeks or mouth areas, residue on the tongue or the roof of the mouth. Pocketing refers to keeping or holding food in the cheeks or other areas of the mouth and not swallowing it. Residue refers to food particles scattered throughout the mouth, like on the tongue, teeth, and roof of the mouth. Other things to watch out for are coughing or throat clearing while eating or drinking, a wet sounding or gurgly voice, or wet breathing sounds. A resident may be saying something like items are sticking in the throat, or something went down the wrong way. If you notice any of the following signs of difficulty, please tell the nurse. Watch for choking. Signs of choking may include a look of panic, gasping, difficulty breathing, the lips turning blue, and hands may move to the throat area. Stop feeding immediately and call for help. And finally, we move to what to do after the meal is completed. We need to encourage or help the resident clean their mouth after the meal is done. We keep the resident in an upright seated position for 30 minutes and report any problems and concerns to the nurse directly. Standard feeding procedure number 6, clean mouth. Check to make sure the resident's mouth is clear at the end of the meal. Ask them to open their mouth and take a look inside. If there is food or food residue, give cues to encourage the resident to either swallow what's in their mouth or take some sips of fluids. If the resident is unable to clear the material from their mouth, tell the nurse. It is also recommended to help brush the resident's teeth after the meal. Standard feeding procedure number 7, 30 minutes. Keep the resident in an upright seated position for at least 30 minutes after completing their meal. This helps reduce the risk of aspiration from reflux or food residue that may remain in the throat due to swallowing problems. This helps in digestion, especially for those who have reflux. Standard feeding procedure number 8, report problems. Tell the nurse if you notice any of the following: that the diet texture served does not match the care plan, that the resident is positioned poorly, any signs that the resident is having difficulty managing the food or fluids given, or that the resident's mouth is not clear at the end of the meal. You are an important part of the resident's day and play an important role in helping them enjoy their meal safely. Thank you for listening, and thank you for following the 8 standard feeding procedures every time you assist a resident with eating.